Hi, everybody. This is Dr. Sadler again here with our question of the week. Okay, so let's look at our question of the week. The nurse is preparing to administer medication to a client with acute hemorrhagic stroke. Which prescription requires immediate follow-up by the nurse? So when the question says immediate follow-up is required by the nurse, that means something is wrong. So remember, you are still liable. You can't say just because the doctor ordered it, you administered. No, you are that patient's advocate. If there's a questionable order, you need to question it and advocate for your patient. So if you administer a questionable order just because the physician ordered it, you are still held liable. So let's look at our responses. 1. Administer intravenous antihypertensive medications. 2. Administer intravenous anti-seizure medications. 3. Administer oral platelet inhibitor medication. Or 4. Administer intravenous fluids using 0.9% sodium chloride solution. So what is happening with a hemorrhagic stroke? A hemorrhagic stroke, the person is bleeding. There's bleeding occurring. And so hypertension is a hemorrhagic stroke. Hypertension is considered a hemorrhagic stroke. So bleeding is occurring. Maybe they had a ruptured aneurysm, so they've got a subarachnoid hemorrhage or something, some type of bleeding, or just high blood pressure is out of control, and so bleeding's occurring. So let's look at our responses. So remember we said we're looking for the one that is inappropriate. So administer intravenous antihypertensive medications. Well, with a hemorrhagic stroke, hypertension is an issue. So they will need those antihypertensive medications. So that's not our answer. 2. Administer intravenous anti-seizure medications. Well, a stroke can cause a person to have a seizure. So that may be something that's needed because that's a possibility. Administer oral platelet inhibitor medications. So what do oral platelet inhibitors do? They cause the platelets to be less sticky. And so that you give them to try to, prevent blood clots from occurring or whatnot. But it's going to increase your risk for bleeding. We already said this person is bleeding. So do we want to increase their chances of bleeding even more? Probably not. And then do we want to administer fluids? Yeah, this person is going to need some fluid replacement, with the bleeding occurring. So your answer is going to be number 3, administer the oral platelet inhibitor medication. Okay, so as we stated, our answer is number 3, administer oral platelet inhibitor medications. Your rationale being the oral platelet inhibitors are contraindicated when active bleeding is occurring. Antihypertensives are the main therapy, while anti-seizure medication is situation specific. Other medications are not suggested for the acute period. However, the client needs to be hydrated.